Hello, you're welcome to the teacher channel. Today it is questions and answers. Questions and answers on standard first aid. Standard first aid. Question and answers. So how much do you know? How much do you know about first aid and CPR? How much, to what extent do you know standard first aid and CPR, and of course other related topics, or how much do you think you need to know? So there are two sides: how much you know, how much do you think you need to know? So with this questions and answer series 1, you'll be able to measure yourself. You'll be able to measure your knowledge about standard first aid. You should be able to evaluate how much you know, how much you need to know. Please, I would ask you to subscribe if it is your first time visiting the channel, or you have visited before but you didn't subscribe. Please do well to subscribe. You can also set your notification bell if you have not done that. The advantage of doing this is so that when next I upload a video, you should be notified so that you can watch. You can also give thumbs up. I notice that people like the videos, but they don't give thumbs up. Please give a thumbs up. You can also put your comment. If you benefit a lot from this video, please put a comment for somebody to read. You can also share it to other people, especially those that you are going to refer to us. Share it so that they can use this presentation to prepare themselves for the training. Thank you so much. I appreciate you. I appreciate all you have done. Even watching the video, I appreciate. Thank you so much. So let's see the instructions and disclaimer. This presentation is for education purpose only. Its objective is to prepare you for a first aid and CPR training. That is the key objective. You can use it to assess how much you know and or how much you need to know. You will definitely find it helpful. You will, for sure. You will definitely enjoy this presentation. It will help you a lot. So let's start. Look at question number 1. Of course, this multiple choice. So it will be a good idea to write your answers on a sheet of paper, and at the end of the presentation, answers will be provided. But I want you to attempt before we review our own the answers. Number 1, question number 1. What are the objectives of providing first aid to a patient? What are the objectives of providing first aid to a patient? A. Preserve life. B. Prevent injury or more injury. C. Promote recovery. D. All the above. What are the objectives of providing first aid to a patient? Question number 2. What is emergency scene management? What is emergency scene management? A. Major steps followed during first aid. Major steps followed during first aid. B. Steps for administering medication to a victim. C. Activities aimed at lessening impacts of emergency. Activities aimed at lessening impacts of emergency. D, A, and C. Which option is correct? Which letter is correct? Write your answer as we move to question number 3. Question number 3. Which of these are the components of the emergency scene management? Which of these are the components of the emergency scene management? A. EMS arrival. B. Scene survey. C. Primary survey. D, B, and C. What is your choice as we move to question number 4? A step during emergency care at which a patient is assessed for life-threatening condition or conditions is called. A step during emergency care at which a patient is assessed for life-threatening condition or conditions is called. A. Secondary survey. B. Primary survey. C. Scene survey. D. All the above. A. Secondary survey. B. Primary survey. C. Scene survey. D. All the above. Question 5. An entry point of the series of first aid activities is called what? An entry point of the series of first aid activities is A. Ongoing patient care. B. Secondary survey. C. Scene survey. D. None of the above. An entry point of the series of first aid activities is A. Ongoing patient care. B. Secondary survey. C. Scene survey. D. None of the above. Question 6. Anything that can cause harm or death is called. Anything that can cause harm or death is called. A. Hazard. B. First degree burn. C. Poison. D, A, and C. Anything that can cause harm or death is called A. Hazard. B. First degree burn. C. Poison. D, A, and C. Put your answer down on a piece of paper as we go to question number 7. The scene survey activities are. The scene survey activities are A. Assessing the patient's RABCs. Assessing the patient's RABCs, that is A. B. Assessing an area for safety and protection. B. Assessing an area for safety and protection. C. Asking a patient for consent or permission. D. A and C. E, B, and C. Since some activities are choose one of the letters that you think is the correct answer and then get ready for question 8. Okay, yes, please subscribe if you have not. If you forgot to do that, please subscribe. And remember to put comment before you leave this presentation. If you have not turned your notification bell, please turn it on. This is very important. Have you liked the video? Have you liked it? If not, please give a thumbs up. Please do that. Thank you so much. Let's continue. Question 8. A first aider is protected by A. Good first aider's law. B. Do no harm law. C. Good Samaritan law. D, B, and C. A first aider is protected by A. Good first aider's law. B. Do no harm law. C. Good Samaritan law. D, B, and C. What letter is correct? Only one letter is correct. And what is that letter? Please put it down. We are now moving to question 9. Which of these obligations should a first aider keep or fulfill? Which of these obligations should a first aider keep? A. Use reasonable skills during first aid. B. Stay within first aid scope. C. Do not abandon a patient. D. All the above. Which of these obligations should a first aider keep? A. Use reasonable skills during first aid. B. Stay within first aid scope. C. Do not abandon a patient. D. All the above. Question 10. Protecting a first aider's privacy is an important obligation for a first aider. Protecting a patient's privacy is an important obligation for a first aider. A. True. B. False. C. All the above. Protecting a patient's privacy is an important obligation for a first aider. A. True. B. False. C. All the above. Question 11. Ensuring that the scene is safe is the responsibility of. Ensuring that the scene is safe is the responsibility of A. Patient. B. Police. C. First aid provider. D. Government. Ensuring that the scene is safe is the responsibility of A. Patient. B. Police. C. First aid provider. D. Government. Question 12. You need to assess a patient for life-threatening condition. You need to assess a patient for a life-threatening condition. What must you assess? What must you assess? A. Responsiveness. B. Airway. C. Breathing. D. Circulation. E. All the above. Question 13. You want to assess a patient's circulation. What should you focus on? You want to assess a patient's circulation. What should you focus on? A. Lung sound. B. Skin color and temperature. C. Bleeding. D, B, and C. Question 14. What is secondary survey? What is secondary survey? When spinal motion restriction is done. B. When non-life-threatening injuries are assessed. C. When a patient is assessed inwardly. D. None of the above. What is secondary survey? A. When spinal motion restriction is done. B. When non-life-threatening injuries are assessed. C. When a patient is assessed inwardly. D. None of the above. Donning gloves is necessary when, this is question number 15, donning gloves is necessary when A. Calling 911. B. A patient is bleeding. C. A patient vomits. D, B, and C. What is your choice? Choose one letter from the 4, and then we are moving to question 16. Routes of disease transmission include. Routes of disease transmissions include A. Direct contact. B. Indirect contact. C. Vector-borne. D. All the above. E. Only A and C are correct. Routes of disease transmissions include A. Direct contact. B. Indirect contact. C. Vector-borne. D. All the above. E. Only A and C are correct. Choose one letter based on what you think is right, and then question 17. You should consider putting a patient in a recovery position if. You should consider putting a patient in a recovery position if A conscious patient is bleeding heavily. B. An unconscious patient is breathing normally. C. A patient complains of anaphylactic shock. D. None of the above. When should you consider putting a patient in a recovery position? A recovery position is putting somebody on one side, left or right. So when do you consider doing that? A patient, a conscious patient is bleeding heavily. An unconscious patient is breathing normally. That is option B. Option C, a patient complains of anaphylactic shock. C, none of these, none of the above. Make a choice and let us go to question 18. An inadequate delivery of blood, oxygen, and nutrient is called. An inadequate delivery of blood, oxygen, and nutrients is called A. Hypothermia. B. Flare chest. C. Shock. D. Hypoglycemia. An inadequate delivery of blood, oxygen, and nutrients is called A. Hypothermia, B. Flare chest, C. Shock, D. Hypoglycemia. Choose one and then get ready for question 19. Here we go. An inflammatory airway condition is An inflammatory airway condition is A. Allergic reaction, B. Asthma, C. Diabetes, D. Seizures. An inflammatory airway condition is. Make your choice. Only one option is correct. What is that? Write it on a piece of paper, please, and then let's go to question 20. Question 20. When is tripod position recommended? When is tripod position recommended? A. A patient just fainted. B. A patient had difficulty breathing. C. A patient has too much sugar in the blood. D. A patient is stung by a jellyfish. When is tripod position recommended? A. A patient just fainted. B. A patient had difficulty breathing. C. A patient has too much sugar in the blood. D. A patient is stung by a jellyfish. Question 21. Which of the following are types of seizures? Which of the following are types of seizures? Febrile, A. Febrile, B. Absence, D. Tonic-clonic, D. Or the above. Which of the following are types of seizures? A. Febrile, B. Absence, C. Tonic-clonic, D. Or the above. Choose, and then we are about to go to question 22, and here we go. Inserting a spoon into a seizure patient's mouth is important to prevent tongue biting. Inserting a spoon into the mouth of a patient that is having seizure is important to prevent tongue biting. A. True. B. False. C. It depends. What is your choice? And question 23 is on the way. Please remember to put your answer on a sheet of paper as we move to the next question. Question 23. A patient is having a seizure. What should the first aider prioritize? A patient has already started having a seizure. What should be the priority of a first aider at that point? A. Restrain the patient from shaking. B. Protect the patient from injury. C. Insert spoon into the mouth to avoid tongue biting. So number C there, the letter C, insert spoon into the mouth to avoid tongue biting. D, A, and C. D, A, and C. What is your choice? And then we go to question number 24. Mr. D has just taken a poison and is conscious. Mr. D, so D is the patient, has just taken a poison and is conscious. What should you do as a first aider? A. Make or induce him to vomit right away. So induce vomiting on that patient, make him to vomit. That is option A. B, give him something to drink immediately. C, call the poison control center and follow their instructions. D, none of the above. Question 25. Mr. D had just taken a poison and is unconscious. What should you do as a first aider? Mr. D, a patient, had just taken a patient and poison. Mr. D had just taken a poison and is unconscious. What should you do as a first aider? A, call 911 immediately. B, put him in recovery position. C, start CPR on him without delay. And D, A and B. Alright, I think that is the last question. Question 25 is the last question. And I hope you have enjoyed. So if you need to change your answer, please scroll back and see if you have made the right decision on any particular question. And now the answers will be shown. Okay, so this is the answer key. So now question 1 is D. So if it is D, check it good, mark it good. Question 2 is D. Question 3 is D. 4 D. 5 is C. 6 is D. 7 is E. 8 is C. 9 D. 10 A. 11 C. 12 is E. 13 D. 14 is B. 15 is D. 16 is D also. 17 is B. 18 is C. 19 is B. 20 is B. 21 D. 22 B. 23 B. 24 C. And then 25 is A. So you can mark yourself out of 25 and see if you score 80 and above, that is good. If you score below 70, then you need to do a lot of work. Okay, so thank you and watch out for series 2. Okay, so again, thank you so much. Thank you for watching. Please subscribe if you have not. Again, give me a thumbs up. I really appreciate before you leave this presentation, just give me a thumbs up. Put in your comment. Your comment will be very much appreciated. Just type something you enjoyed on this presentation. You can also share it. Okay, so thank you so much, and I hope you're going to come again. And of course, there are other videos and other questions and answer presentations on this channel. You can always look for them. Thank you so much, and see you next time. Bye bye for now.